Most people hear scoliosis brace and picture bulky plastic and a guaranteed path to surgery. But what if that's no longer the case? I'm Dr. Juan du Plessis, Clinical Director at ScoliCare, and I've helped thousands of families navigate scoliosis treatment without surgery. Today, I'll show you how modern bracing has changed and how it's helping patients avoid surgery. Here's what many don't realize. Bracing has evolved, and in the hands of a trained scoliosis clinician using today's advanced systems, it can not only slow a curve, it can change the trajectory of someone's life. Here's the problem. Despite decades of progress in scoliosis care, most people still think of braces as something rigid, outdated, and ineffective. And because of that, they wait, they hesitate, or worse, they opt for surgery before exploring every non-surgical option. We see it all the time. Families walk into our clinics already feeling defeated. They've been told that bracing won't help, or that it's just a temporary step on the road to the operating room. But that belief, it's based on old models and outdated science. And the real danger is this. If you miss the right moment or the right brace, surgery becomes harder to avoid. That's why this conversation matters, not just for clinicians, but for every parent, teen, and adult navigating scoliosis today. Let me share the story of a 14-year-old gymnast who came to us with a 33.9-degree thoracolumbar curve. She loved gymnastics and had already been in pain for months. Her doctors told her parents that surgery was the only option, but her curve wasn't yet severe enough for surgery. And because she still had growth potential, the risk of progression was high. That made it the ideal time to intervene. We recommended a custom 3D designed ScoliBrace and introduced her to our ScoliBalance Scoliosis-Specific exercise program. Every day she wore her brace and followed the Scoliosis-Specific exercise routine we gave her, staying consistent and motivated. After 5 months, out-of-brace x-rays showed the curve had dropped to just 14 degrees, and after 2 years of bracing and exercises, it measured 16 degrees, halving the original curve and remaining under surgical thresholds. Her posture improved noticeably, her pain reduced, and she got back to the sport she loved. It wasn't just about numbers, it was about reclaiming her future. Now you could be thinking, that sounds too good to be true. And I get it, because for years that kind of result felt rare and almost impossible, especially for adolescents with moderate curves. But what made this case different wasn't just luck. It was the method, and more importantly, it was the brace itself. You see, today's bracing isn't just about locking the spine in place, hoping for the best. It's about intelligent design, real correction, and personalized treatment that actually changes the spine's direction, not just delays the outcome. So what makes modern bracing work when older braces so often failed? This comes down to 3 key differences. First, today's braces are 3D designed and custom built. At ScoliCare, we use the advanced imaging to map every angle of the curve, not just from the front, but in 3 dimensions. That means we can create a brace that applies targeted forces in the right directions, helping to guide the spine to a better position, not just hold it still. Second, modern braces like the ScoliBrace are corrective, not passive. Traditional braces were designed mainly to slow progression, but the ScoliBrace is designed to improve alignment. It works like a gentle guide, realigning the spine into a more corrected posture each day it's worn. And third, we integrate bracing with movement-based therapy. This isn't a one-size-fits-all device you wear and forget. We pair it with our program ScoliBalance, so patients build strength, awareness, and postural control while the brace does its job. It's not magic, it's biomechanical engineering, evidence-based protocols, and a personalized approach that gives the body a real chance to change. And the sooner we start, the more potential we have to work with. So now you may be wondering, how does this apply to you? Maybe you just got diagnosed. Maybe someone told you wait and see, or that surgery might be on the horizon. This is the part where we move from understanding what's possible to know exactly what to do next. I will walk you through the key steps we recommend for families considering modern bracing and how to know if it's the right time to act. Now, let's get into it. Step 1. Get a proper scoliosis assessment, ideally a 3D one. Not all scoliosis cases are the same, and not every curve will respond the same way to bracing. So before anything else, make sure you're getting a comprehensive evaluation that includes postural photos, x-rays, and if possible, 3D body scanning. This gives us the full picture. Step number 2, find out if your curve is flexible and still changing. Bracing works best when there's still growth left and when the spine has some form of flexibility. If the curve is stiff or fully matured, other options may be better. But if we catch it early, we have far more control and far better outcomes. Step number 3, ask about custom corrective bracing, not just any brace. Not all braces are created equal. A generic or rigid design may not provide the correction your spine needs. That's why we work with ScoliBrace, because it's built around your individual curve pattern, your posture, and your goals. And finally, step 4, choose a provider who understands scoliosis. This is critical. You want a clinician who understands biomechanics, curve progression, and how to integrate treatment with your lifestyle, your movement, and your long-term goals. So, you've seen how far scoliosis bracing has come and what it can really do. Today's custom 3D braces aren't just holding curves in place. They're helping many patients, especially teens, reduce curves, improve posture, and avoid surgery. But timing matters. The sooner you act, the more options you'll have. So if you're a parent, a patient, or a healthcare professional, don't wait. Book a consultation with a dedicated scoliosis clinician through the link in the description and find out what's possible for you. I'm Dr. Juan du Plessis, and from all of us at ScoliCare, thank you for watching.